So in El Paso, for example, we already have a system that needs help, needs funding, and that's with some really good coordination that's already going on, some great advocacy that's already going on at the local level. But if we don't receive the funding in our community that we need, we'll have 1,500 people on a wait list. That's at the current need, the current level. As we begin to see the influx of more families and more troops from BRAC, for example, many of these families are going to need the kind of services that other El Pasoans already need as well. And they'll get some of that from the feds, but for returning soldiers, for example, many of whom have been deployed back-to-back in back-to-back deployments, 2 deployments, 3 deployments, many of them with high incidences of post-traumatic stress disorder. It's not necessarily just about the soldier, but it's also about the wives, the children, the mothers-in-law, the fathers-in-law, the kind of stressors that particular mental health disorder, I guess it would be called, stresses on the family. And so we have to be prepared for a lot of that need, but we already are not receiving the adequate funding that we need to care for the folks in our system. So we need to care for those folks in our system and be prepared for the